Hi, my name is Dr. Edward Eckert, and I am the founder and CEO of Hormonify. We are here to discuss not only the history of the company and my motivation, also to explain to you the basis of what you need to know about hormone replacement therapy. It was quite a journey. You are here because you're interested, and I will say that you're part of the counter-revolutionary movement in medicine. What does that mean? It means that for a short period of time, the pharmaceutical model took over what I would call the traditional model. The traditional model of medicine included the combination of treating the body, the physiology, the pathology, and treating the soul, the spirit. They are united. They are unique. As humans, we are created with both aspects of our world. And for a long time, about 150 years, the pharmaceutical cartels have basically ignored the most important aspect of treating and healing someone, and that is the combination between your body and your spirit. We use emotion to explain the combination of how to go from one world to the other, but I'd like to explain to you more how Hormonify is based on both worlds, because you have to have that to really cure people from disease process and also to improve their quality of life. So let's go back and talk a little bit about the history of medicine. Medicine has been around for a long time. It has been at least documented in the Old Testament. So it's been at least 4,000 years where people have been treated with various products. In the beginning, it was all natural products. It was all products that was grown somewhere in the world, that was refined, and with a unique knowledge was able to utilize that to basically cure all disease. So what happened? Well, what happened was through the transition times, as medicine became more and more prevalent, medicine basically is using poisons to go ahead and, in a very small amount, to go ahead and treat your symptoms if it doesn't kill you. The trouble is that medicine now is the primary focus. Thanks to the Rockefeller Foundation and the AMA, almost all other modalities of treatment, whether it be spiritual treatment, acupuncture, which is Eastern medicine, herbal therapy, nutrition, homeopathy, chiropractic, all were excluded from the AMA medical schools in exchange for huge grants. So we see today a result of tremendous amount of money being funneled into the, I would call it the pharmaceutical-based medical schools, hospitals, and of course into the therapy that we all are experiencing. So what's happened? What we see is that despite how much money we put into the system, the healthcare has not improved. Not only that, it has gone down. Pharmaceutical companies believe in treating the symptoms of a problem. Hormonify, and I would call biblical-based medicine or traditional medicine, believes in treating the cause. That conceptual difference is major. You need to understand when you go to a doctor and the doctor is told, I have this symptom, and he says, okay, I'll give you this script. That is the old method, which now to me and to many, many people around the world, especially in the academics of this country, we're seeing a change, a counter-revolution, so that people are saying, one second, is it really getting better? I'll give you an example. There are 60 million American women on antidepressants. 60 million. Is depression less? No, it's not less. Recently, many studies have been done by counter-revolutionaries to say not only does most antidepressants not treat depression, it can make it worse. We see that in violent activities. Whether it's cause or effect, I'm not sure. I'm not an expert in that area, but I do see that the trend is now changing back to what I would call a biblical sense of treating the person as a whole and looking back and trying to understand what is causing your symptoms. At Hormonify, after many, many years of research, we know now about 26 symptoms for a woman and about 16 symptoms for a man that are attached to the problems with hormone imbalancing and deficiency of hormones. So, in other words, if you have a pharmaceutical-based theory, you're going to be treating someone with 10, 15, 20 medications and still not getting to the cause of the problem. So that to me is outdated and quite frankly should not be the primary focus for anyone with a problem at all. We need to start educating ourselves, which is the big thing about Hormonify. On our website, we have a lot of material. I wrote a lot of articles to try to educate people so that we can understand what is going on with you. So when you come to us, We can ask you very few questions. Except for going over symptoms, it's very obvious when your symptoms are revealed to us that you need to do A, B, C, D. We have a very, very structured environment here. We go through that process just like any medical doctor should, but then our treatment regimen is individualized to your specific needs. So people ask, so how did I get there? How did I get to the place where I am today? I was traditionally trained. I went to a great medical school, I'm very proud of. And I went ahead and did residencies. I did extra work in understanding the pathophysiology of the OBGYN, which is what my specialty was. I got into it because OB to me was the most spiritual aspect of medicine. The incredible delivery process to me was something that captured my interest. I couldn't really understand how you would do anything else at the time. So to me, it was already a movement along that trail of combination of spirituality and physicality. So I became board certified. I did the standard stuff that every OBGYN does, except I said, 1 second, let me figure out what OB patients need. What they need is really not only great nutrition, which is pretty obvious now, but in 1980s, nobody was talking about it, and they need exercise, planned exercise. So I had a cushioned room that I made that had a Pilates instructor. So we had Pilates for pregnancy. That was 1986 when I started that. And I had a nutritionist on staff to go over every single patient's nutritional diet, getting it maximized. And believe it or not, my C-section rate was less than 10%, when the area that I'm in, which is South Florida, had a C-section rate of 30%. So to me, the confirmation of the end result was that I'm going along a path that I think was extremely important. Of course, my colleagues didn't like me very much because I had all the patients. I had a waiting list. People couldn't, they were waiting at the door. So if someone had a miscarriage, God forbid, or someone had a problem, they moved away, I would be able to call the next person on the waiting list, and they were transferred to my practice. So that was in the 80s, early 90s. I remember the day at this desk in 1994, I had my nurses pull my stack of patients who had breast cancer. At that point, it was concerning to me. And I sat down and I studied it on a Sunday. I remember that day because certain days you remember. You know, you remember the birth of your child, you remember your marriage. But I remembered that day because it was the birth of Hormonify. I went through the files. It was about 30 files. And I sat back right in this chair and I said, what is going on here? Why are we seeing all this breast cancer? And the common theme, the commonality that I established after studying these charts for hours was Premarin. Every patient was on Premarin. I didn't know. I was told to give patients Premarin if they had hot flashes, night sweats. We didn't know very much, and we weren't taught very much at the time in how to treat women in that disease process. In fact, most of the time, most other doctors would be giving these patients antidepressants. That was the big thing then in the 90s. Every woman who had a problem was considered psychiatric. Now, I'm not going to debate whether or not that's good or bad. I'm just saying that's what it was. So I went ahead and started a research facility that we funded, and that was called the Menopause Institute. At that point, I was just studying what I would consider the menopausal age patient with what is going on with their hormones. And lo and behold, I discovered through my research that indeed it wasn't estrogen that was causing the symptoms. It was progesterone and testosterone. So here we were treating something that took care of the vasomotor instability, which is the hot flashes, night sweats, and we're making the patient feel that they're being treated, but that wasn't the cause of, quote, menopause. All the symptoms that I started to see with patients going through that period in their life was not being treated properly. So I started researching the literature, medical literature way back. I couldn't find anything. Then I started studying the pharmaceutical literature, where pharmaceutical people, research people would put in articles, and lo and behold, I found 20 articles, at least at that time, about the dangers of unopposed estrogen causing breast cancer. Now, why was it in the medical literature? Why was it on peer-reviewed journals? Why? Because if anyone sees peer-reviewed journals, it's being sponsored by, guess who? Pharmaceutical companies. They publish, produce, pick the editors so that the articles are going to be favorable to their industry. So I realized that it was more than what I was beginning to understand the truth behind what is going on in medicine, was that it is basically propaganda. So I started to research further, And I started to look at literature from Israel, from Germany, from England, from mostly European countries that were using natural therapies for treating menopause. And I started to think, what is the way to approach the problem? And I tried to understand, what can I do here to begin to treat the problem correctly? So I set up an institute, and the institute studied about 1,000 women over 8 years. And we gave patients this medication, which was all bioidentical at the time, and see what the blood levels were, see what the symptom relief was. So the resolution of symptoms to me was the most important thing. And I tried to work with these patients, which were very kind because they were being stuck every month. And I tried to then evaluate, how long does the hormones last in the blood? Nobody had done that. Even today, 99% of the doctors who are giving hormone therapy give it once a day. They don't know, which is scary, that it doesn't last the whole 24 hours. So you're taking a drug that peaks and goes down. By 12 hours, it's gone. To me, that made no sense. Now, they didn't know, but they didn't care to know. All they did was, the pharmaceutical companies say, here's a drug, take progesterone at night, take the estradiol patch in the morning, and that's it, or estradiol pill in the morning. Now, the patch lasts longer, but again, the estrogen patch does not absorb on a regular basis. Another thing I found that when I researched was that about 1/3 of the patients on Premarin had no levels of anything. But these patients were feeling better. I said, oh, now we got a placebo effect thrown in. But it made it worse because those patients without any levels of hormones from the Premarin pill should not be included in the risk for the breast cancer. So those studies, and the pharmaceutical companies must have known that, were putting out studies about breast cancer risk, which really were not true because a lot of the patients didn't have any levels at all. They didn't absorb. It was defective, 0. So I really began to understand the difference between what I would consider the spiritual nature of medicine, which should be a healing process, and it should be based on truth and honesty, versus the pharmaceutical method. So I went ahead and started to prescribe in 1994 the hormone therapy that I put together, which had changed dramatically over the years. In the beginning, I was hesitant to giving the right amounts because I didn't know what the effects would be. I slowly increased the amounts. I added adrenal gland function because I found that even though people had sex hormone deficiencies were treated, I went ahead and found out that indeed the adrenal gland was deficient. I added that into the therapy. Various stages of the therapy that I had was based on my research. Now, in the beginning, my colleagues didn't understand what I was doing. They were saying, well, you were giving vitamins to people to treat medical problems, because they didn't understand, nor did they care to understand, that the body needs basic nutrients, needs basic products that it can use to build and cure. There are a lot of studies out there to show that what happens with pharmaceutical companies, what happens to physicians who are trained under AMA guidelines, is that the alternative therapy, which they call alternative, I call it traditional. I think the pharmaceutical therapy is alternative. It's alternative logically, commonsensically. Therefore, I believe, and this is something that I've proven over the years, now it's almost 40 years I've been doing this. So to me, it's not just a fly in the sky sort of event. It is a concept that you as patients need to begin to understand and begin to do your own research and every problem you have, which is what I've done as well. So I have many patients who come in. I had one patient last week. He was 71 years old. He was on 17 medications. 17. And I asked him why he was on this drug, that drug, and he didn't know half of them. He had no idea. So I said to him, maybe you should go back to your doctor and sit down with him and explain how each of the drug, why it's there, and also what are the interactions of the 17 drugs in your body. And he looked at me and goes, he won't know that. That's correct. Why? Nobody will know that. It's incredible to say that people will take these drugs, which are poisons. They work to some benefit, but sometimes they cause a lot of complications, side effects. 17 of them put together in one body. And we're supposed to know, it's going to do really well for you. So far, I don't really see evidence to support that. The health of the American people have gone down since the Medicare Part D was allowed, which means that medications for Medicare-based patients are now being paid for on Part D, and I have not seen an improvement statistically of people's health. So what does that tell you? It tells you that you as a consumer need to take control of your health care. You have to be your own advocate. Stop going to the doctor and just saying, okay, I have these symptoms, and he gives you a drug. Ask him, on what basis, what research have you done or have you read that says this drug is going to do this, this, and this for me, not just for some study group of 15 patients somewhere in Colombia. So I'll give you a story. For a while, this country was using what's called Norplant, which was an insertable progestin product for birth control. I read the insert, and in Colombia, 50% of the patients requested removal. But when you see the advertisements, you know, the big print, it says 14% were removed. Why? So I started to study it, and I asked a rep, whose name was Barbara, who happened to have the Norplant. And I said, I read the insert that you gave me to use this drug, basically an insert that was implantable. And she said, you're the only doctor who ever read it. I said, how many doctors have you seen? I see 150. You're the only doctor who asked me that question. And honestly, you're right. Because a lot of the patients in Colombia where the study was done lived up in the mountains. And they couldn't get there. They couldn't get it removed, but they requested it removed, but they never got it removed. Therefore, the study showed a very small percent got it removed, but actually 50% of the patients wanted it removed. And guess what? I never put one in, but I took out hundreds. Patients felt terrible. Progestin therapy makes a lot of women feel disgusting. They feel depressed. They lose their sexuality. They gain weight. All the horrible things that we see. And therefore, now it's implanted. Of course, now you have to have it removed to go back. So what am I saying? I'm saying that don't believe anything, including me. Everything I say, go to the research. Don't believe a word I say. You can go to my website, you can get some information, and then go out and do your research before you see a doctor. So why did that happen? Well, I think there's a concept. It's kind of mob mentality, where doctors especially do not want to be considered out of the framework of what the mass media or the masses are going to say. They're afraid. They're fear-based. Now I'll ask you, in your own life, whenever you're fearful and make a decision, what percent of the time is it right? In my life, it's almost zero. Fear-driven behavior is almost always wrong. It's emotional. And that's what they want to do. They want to make it so that you cannot think clearly. You cannot take the time. Everything is a rush. Here, take this drug. Well, doctor, how about this, this, and this? I'm sorry, I got to go. So they don't give you an explanation. Be very careful, because these drugs have serious complication side effects. So we have an area of medicine here, which is hormonal based, but it extends way beyond just what are your hormone levels and how do we treat. So I see probably over 1,000 patients a month. And I would say the vast majority of them has seen 2, 3, 4, 5 doctors before me. And I have a syndrome that I call PTSD medical, which means that these patients are so freaked out by their experience with doctors who don't know anything, who are giving them this, giving them that, basically BSing them to the point where they're so confused and upset and frustrated and angry that I have to deal with the PTSD medical before I can even begin to talk about the hormone therapy, because they're just whacked out. They come here, they're crying, they're upset, they're angry. So in other words, what's happened in medicine, which is really unfortunate, is not only are they not helping people, they're actually creating a tremendous amount of anxiety and frustration among the patient population, especially women who are younger than, quote, the average age of hormone failure. I see every week a few patients in their 30s who have something called premature ovarian failure. They're told by their gynecologist that there's no way it could be hormonal, you're too young, you need to see a psychiatrist. I still see that today, and this is being taken in 2025. I see it all the time. What right does this gynecologist have to tell a patient that is psychiatric because he or she does not know the first thing about hormone replacement therapy? It pisses me off because I hear it all the time. I have patients who are younger, who are in their 20s, and that's why we established a new division of Hormonify called Hormonify for Young Adults. because patients believe that, oh, I'm too young for hormone therapy. They're put on the birth control pill, which is a very strong estrogen compilation, usually with a progestin, which is what we discussed, and they have the side effects. And the doctor says, well, nothing much we can do. You're on the lowest dose. Goodbye. Have a nice life. So they need the birth control because they don't want to get pregnant. A lot of these people are in college, universities. They're looking for their career advancement, and yet they feel crap. They gain weight. They don't feel sexual. They are moody as hell. They're having problems with their relationships, and nobody's doing anything about it. They changed one pill to the other pill, which to me is completely stupid because there's still the problem is, the etiology of the problem is that they're on estrogen, high-dose estrogen with no hormones that require for a woman to be balanced. So I like to see hormone therapy looked at deeper. It's all about the yin and yang. It's the balancing of hormones that doctors do not understand. It's not just, here, you have a problem, need birth control, take birth control pills. I did that. I was trained that way. But there's no way today I would prescribe birth control pills without prescribing the hormones that are necessary to be replaced, because it's suppressing ovulation. Ovulation produces a balance in a woman that is required not only for her function, for her emotional function, her intellectual function. There's study to show that birth control pills inhibit the actual maturation of the frontal lobe if it's taken in their teens. Now, that's something relatively new, but you have to be suspect when you're dealing with something as complex as hormones, where you just say, here, take the hormones, stop the production of progesterone, which is important for a woman's development, and then everything is going to be okay. Now, 30 years later, boom, we got this problem. We have young women not only who have frontal lobe issues, which is behavioral, relationship issues, but also we have a problem with infertility. Now, infertility is a very serious problem for women in their 30s who put off having babies, and add on to that, they've been on birth control pills for 15 years. So the reason why I'm bringing that up now is because the new area that we're focusing on is younger women who are in their teens and 20s who are put on birth control pills. Okay, that's something you need, that's your decision. However, are not being replaced with progesterone, testosterone, and adrenal gland function. That is long-term bad news. So to avoid that, to be preventive, that is where I am saying to you, you need to come and see us. If you're a mom and you have a daughter in college, it definitely should be addressed, especially if they have the triad of horror, which is weight gain, depression, and low sex drive. So they're in college and they have these three symptoms and they're miserable. So where am I getting at? Every area that you are involved in your healthcare system, you have to question seriously everything that is told to you, especially if they're going to give you a poison. Poisons are the basis of most medicines. Plus, of course, as you know, most of them are made from petroleum products, which is interesting how Standard Oil and Rockefeller got involved in the pharmaceutical industry. That's a story maybe we'll discuss later, but it's a fascinating area that I think we can cover later. How did we get to this place? That's the question. We got here because doctors just don't give a shit. Period. It's that simple. When I was growing up, we had doctors in our family. They were respected. They were dedicated. They cared. Sometimes a little too much, I think. They let their personal life go. And we had lawyers in our family. And everyone said, the lawyers, they're corrupt. They're dishonest. Nobody respected the lawyers in our family. Everyone respected the doctors. I thought it was a better deal to be a doctor than a lawyer because I liked the concept of doctoring anyway. However, being an empathetic person, I thought that was better suited for me. But today, there's no difference. Doctors are not in a position to be respected. They lost control of the healthcare system. They got bought out by big corporations that run their practices. They don't care. They just need to see X amount of patients per hour. Therefore, if they don't care, they shouldn't be doing doctoring. It's not that you need to challenge them because, unfortunately, the system is so corrupt at this point that you're not going to be able to. People say, I'm going to change primaries. I said, fine, but you're not going to find anyone better. The system is basically how many patients can you run through the mill, period. That's it. No other consideration. Oh, I love my family doctor. Of course you do. Because you're revealing things to him or her. You're close. You're a nice person, most likely. But it doesn't mean they're there to help you. They're there to run you through the system And two things they need to do. One, increase the cost of healthcare by ordering unnecessary testing. And two, is give you as much pharmaceutical products as they can. That's their job. How do I know that? AI studies were done. Computer technology is evolved. Programs exist where if you sit in front of a computer, since doctors don't examine you anymore, and you run your symptoms through there, not only are the computers more efficient, they'll order less unnecessary testing, but they order much less pharmaceuticals. And they're also based on nutrition. So they're going to tell you, you need to take this supplement, that supplement, which is what we do too. We try to take care of the problem preventively by giving nutritional counseling. So the computer does better. Why are we not sitting in front of a computer even at home and doing the thing that is shown to be more effective? That's the question you need to think about. Why didn't that take over medicine when indeed it's more efficient, more cost effective? And I gave you the two reasons, and that could be disputed, of course, and it's going to be hard to be proven, but the studies done with AI-based computer programs in medical care show me that indeed that is the reason. And that's pretty controversial. I mean, that's something that really you should be questioning. I'm not sure if Mr. Kennedy is going to address that issue, but to me, that's major. That is where we're moving toward. Where in your home, you may pay a fee, it's covered by your insurance or not covered by your insurance, going through your history, giving everything that we do in our office when we take your history, and then what's the treatment regimen? The treatment regimen is established by the computer program. It gets better over time, just like with mammography. Mammography used to be needed every year because you didn't have what's called CAD, computer-assisted detection. Therefore, they made mistakes. I remember 30 years ago, they were missed. Mammogram every year, picked it up, no net loss. In the last 10 years, I've yet to see one CAD-based mammogram miss anything. And it takes about 2.5 years to grow a breast cancer to the point it's detectable. So therefore, every year mammogram was based on a 30-year-old model, and today it's not applicable anymore. But do you see doctors say, oh, you need a mammogram every 2 years? No. Why? Because it's money. Money generation. And there's a new thing about mammograms, by the way, is, if you have a breast cancer, it's caused by the hormone therapy, whatever it is, estrogen-based therapy. Now, in my practice, I have over 1 million patient months of experience. I have 0 stage 2, 3, and 4 breast cancer, which is toward lethality. In other words, not one person has died from breast cancer in my tens of thousands of patients. 0. Therefore, if you have stage 0 or 1, treatment will be lumpectomy with or without additional therapy. No one dies. Yet you be out there and you hear all the time that people are dying from breast cancer. It's a terrible disease, but it's not a breast disease. It's an immune system disease. So you're treating the breast, but you're not treating the underlying problem, which is the immune system deficiency of not picking up the original cells that become anaplastic in the breast, secondary to most likely toxins, poisons, viruses, bacteria, and then it accumulates in the breast because lymphatics drain in the breast. Are you seeing your doctor say that? What's your immune status? Let's check your coenzyme Q10 to see what the level is, vitamin C. Are they doing that? No. Why not? Because they don't want you to be healthier. The model is disease. Now, in our practice, everyone now gets nutritional profiles, meaning we check omegas, we check minerals, we check antioxidants. Why? The basis of everything is your nutrition. And today, with the food supply being what it is, every single time we check a person, we have 1 to 5 deficiencies. So we specifically treat those deficiencies as opposed to saying, here, take a multi. Here, take this, take that. You may not need it. We have the laboratory capability of understanding exactly what's going on with you nutritionally. But so why isn't everybody doing it? You need to think about that. Take a step back and say, why is my doctor not doing that? Because they don't care. They don't care if you're healthier. The more disease you have, the more money they make. That is the model that, to me, was the revolution in the turn of the 20th century. And now it is going back to what I think is a much healthier place, a much more positive place, so that people get control of their health care and also prevent a lot of disease. So what does that mean? For example, in my patients who are on my therapy. We have patients on it 30, 40 years. And we have tons of patients who come in for one reason. They're found to have osteoporosis. What is osteoporosis? Osteoporosis is the loss of bone density, and they checked in the lower back and they checked in the hip. Why is it so important? Because as a person ages, men and women, they begin to lose bone, especially if they have hormone deficiency, mainly progesterone and testosterone. So it's important to check. It's called the DEXA scan. And we do it here, but also we get patients from all over the country, all over the world. And they have bone scans and they have osteoporosis. Osteoporosis is a diagnosis established by the World Health Organization. I think 1996, it defined it. And it defined it in such a way that it really needs to be treated. Why? Because you're at increased risk of fracture, atraumatic fracture. So it's not the same thing as you fall down the steps, you get a fracture. If you're going to fall down the flight of steps, you may break a bone. If you have strong bone or not, that's probably not going to change it. I'm talking about no trauma, you just bone fractures. Now, what's the significance of that? Significance is that if you have osteoporosis, your longevity is cut down about 3 to 4 years. Boom. That means that your tendency to have a longer life is cut down by 3 to 4, almost 5 years in some cases. So you want to treat that. That's 5 years of life to see your grandchildren. Why isn't every doctor treating it? How do you treat it? The medications that they give you, which is unfortunately not questioned by the patient, is that the medication will increase your bone scan 16%. But what does it do to the fracture rate? So if you ask the wrong question and you get an answer based on pharmaceutical thinking that your bone scan looks better, therefore your fracture rate goes down, that's what they're playing with you for. That's the intellectual dishonesty that they're telling you. Therefore, we'll give you this medication, which can kill you, can cause liver disease, can cause this and that. But however, your bone scan looks better. The fact is that when you look at the studies, which I have done closely, there is no reduction or minimal reduction of fracture rate over time. Minimal to the point where I don't even believe it. However, in my hands, with proper therapy, we have 0 fractures. 0. No osteoporosis-related fractures. Tens of thousands of patients. Why isn't everybody doing it? What I had to discover and learn and remember from my medical school days was that progesterone blocks osteoclasts. Osteoclasts are the little guys that eat your bone. Estrogen therapy in the 1990s was, they made believe that we're going to give estrogen therapy to help osteoporosis because estrogens stimulate what's called the osteoblasts. Osteoblasts are the cells that lay down bone. That was disproven. Why? Because osteoclasts get stimulated and eat bone faster. So when you have knowledge that's limited, let's say 1% of knowledge, and you begin to start selling drugs on that 1%, and for a while they tried to use estrogen as the therapy for osteoporosis until the study showed it wasn't true. I still have doctors who put people on estrogen with osteoporosis. Today, 40 years later. Where have they been for 40 years? On the golf course. Taking cruises. Every week I study about 3 to 5 hours because things are constantly changing. And that's because I care about what's going on. Things are changing for the better. There's a lot of doctors like me who are coming out and researching and having articles, doing podcasts like this. Pass this on to your friends because it's a conceptual change that has to happen for you to take charge of your health care versus the doctor who you think cares for you because you think doctors care. Well, that's unfortunately not true. All right? You just have to accept that. You have to use your own experience. And anyone who's been in the hospital lately will say, wow, you're absolutely right. They don't care. They're in the room for 10 seconds, got to go. All right? And you're put on medication. And if they don't kill you, you're let out of the hospital. Then you have to wait 4 weeks to see a doctor in the office when you're supposed to see him in 3 days. Why? Because unfortunately, today, volume is the way that doctors are making their money. And to me, that is not a good way to do it. It should be based on quality time, good history taking, good analysis, good laboratory confirmation, and then therapy and explain to the patient why we need to do what we need to do. That's an old concept. That's something that's 2,000 years old. And I think that's the only way to go. So I almost didn't become a doctor because when I was in college, I was interested in doing it, but I kind of lost my way for a while, as all college kids do. And I wanted to be an actor, believe it or not. After seeing this podcast, how could that be? But I did. I minored in theater. I was fascinated by acting. And so I used to go to the Actors Studio in New York. I drove a cab my senior year when I was in New York. And I used to stop by the Actors Studio, that's Lee Strasberg, and met a lot of the guys who became amazing, famous people. At that time, this was the 1980s when I was, no, it was 1970s. And I remember going in and sitting there and listening to these people do cast issues and practice sessions, and just used to watch. And the people who were there didn't mind me there. I told them who I was, and I'd leave. And so one day I'm speaking to them, and they asked me to come up and do a casting with I forget who it was now. Marlo Thomas. That's who it was. And so I read the 3 pages, and I was the other person who she was acting with, and I'd help her with her lines, And they said, "How do you know her lines?" I said, "Because I memorized the 3 pages. It was only 3 pages." And so they let me stay, and they kept on calling me up when I was there because they were curious, I think, more than anything. Who is this guy? And so I said, "I'm on the way to medical school. I'm waiting to hear, and I don't know where I'll go yet, but hopefully be New York." And one day I'm in the back eating my soup, and Lee Strasberg comes up to me. And as I understand that you want to be a doctor, what are you doing here? I said, I like acting. I like what you're doing here. And he put his finger out like this with his long finger. If you know Lee Strasberg, he's kind of like his long finger hands. And he said, "I want you to become a doctor. Don't ever become an actor. You should be a doctor." And I said, "Is that your Jewish grandfather act?" And he laughed and turned away. But because of him, I think I didn't become an actor. I went to medical school. And you're the benefit of all my years of research, all my years of experience. So I want to thank you very much for attending this podcast. I had a lot of fun. I hope you did too. And if you have any questions at all, just drop an email to info@hormonify.com. And one of our peeps are going to go ahead and respond to you, and we'll go from there. We also have a wonderful group on Facebook. What's the name of the group? Yeah, it's our Facebook community group, I'm told, has thousands of people in it, and you can go in there and you can interact with people with your similar issues. And of course, we're more than happy to help you with any needs you have. So thank you, and until next time, we're going to begin to discuss more in depth the specific problems that you may be having, and have guests on that we're going to help you as specialists and experts who are going to help you with your therapy programs. Thank you very much.